I'm Riley Reese. This is the Sophia Unfiltered podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. I'm grateful to share these powerful stories with you, and I especially love listening to the conversations that are led by my friend and co-host, Dr. Michelle Cole. Michelle is a licensed clinical psychologist, somatic experiencing practitioner, and yoga teacher. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go.
Hi, everyone. Welcome back to Sophia Unfiltered. It's Michelle flying solo today with our guest, Alison Scola. It was the gift of chronic pain that brought Alison to her therapeutic yoga practice in 1993. Through study and practice of the 8 limbs of yoga, she found powerful tools to heal her body and mind. Inspired to help others, Alison trained at the acclaimed schools of White Lotus Foundation, Integrative Yoga Therapy, Yoga Line at Kauai Yoga School, Healing Hand Schools of Holistic Health, the Novato Institute for Somatic Research and Training, the Upledger Institute, and Somatic Experiencing International. Alison is a trauma-informed certified yoga therapist, licensed massage therapist, Reiki master, and experienced yoga teacher trainer. And she was my yoga teacher too. For the past 15 years, Alison has offered group and private yoga therapy as a powerful natural healing tool. She has vast experience assisting clients in successful management of chronic pain syndromes, fibromyalgia, PTSD, anxiety, depression, addiction, neck and lower back pain, postural alignment reeducation, MS, arthritis, chronic fatigue, cognitive decline, degenerative disc disease, post-operative joint repair, and cancer treatment recovery. Alison's massage therapy sessions integrate her training in advanced circulatory, sports, shiatsu, deep tissue, myofascial release, upledger craniosacral, and Reiki. She is committed to offering space for her clients' body and nervous systems to unwind through nurturing touch in a trauma-sensitive environment. Her story is a testament to the transformative power of yoga and touch in healing mind and body. Alison Scola, welcome to Sophia Unfiltered.
Hi, it's so nice to be here and to be here with you, Michelle. You're one of my favorite human beings on the planet Earth. So thank you for having me here and welcome to both of us. Hello, we're here.
Just a big old love fest today.
Right?
Yeah, Alison, I would love for you to talk to our listeners a little bit about this transformative journey you have. And you talk about the gift of chronic pain. And so that's kind of a paradox there. So could you tell us a little bit about your journey and how you found your way to these healing modalities?
I would be happy to. And yeah, it is an interesting sentence, isn't it? The gift of chronic pain. I feel like for myself, the the experience of living with chronic pain has been one of my greatest teachers. It's really brought me to some of the most powerful growth that I've ever had. So I'm grateful for my body as this teacher. And thankfully, I'm at a point in my life where I no longer have to learn through excruciating pain. But there were a lot of years that was kind of the main means for me to listen to what my body was saying. It needed to be really loud because I wasn't very attuned to listening to the quieter whispers of the wisdom of my body. My journey looks like I was I was raised in a really beautiful home with loving parents that were doing the best they could to be present with their children and provide everything for us. And I still got to the other side of childhood with a degree of developmental trauma. So, because of experiences that had happened to me as a child, and I had a tremendous amount that I was holding on my own that I didn't know how to process. And so, like most people, I developed some coping strategies to handle the intensity of what I couldn't manage on my own. I had extreme anxiety and extreme depression. If we look through a particular lens, we could call it that. I had also been in multiple car accidents from the age of like 7 till 19. I had been in probably around 11 car accidents. Most of those were whiplash injury accidents. I bonked my head on a lot of windshields. This was back in the days where seat belts, what's that? Like we weren't really wearing seat belts. Um, and so by the time I was 19 years old, I was an alcoholic and a drug addict. And that main coping strategy, I now understand, was me attempting to regulate my own nervous system. It was me attempting to self medicate, living with a tremendous amount of anxiety, living with a tremendous amount of depression, and a tremendous amount of physical pain. So I got sober through the means that a lot of people typically do. I got to go to a treatment. My family helped me. And then I started going to Alcoholics Anonymous. And most of the focus of my recovery at that point was to really look at this idea that there was really something wrong with me, that I needed to fix this thing that was wrong with me. And I was following all the things that everybody was telling me to do. And there was some change starting to happen in my life. I wasn't using those old coping strategies that were labeled as addiction. But what started happening was the physical pain that I was in got absolutely intolerable. I wasn't able to function. So by the time I was probably about a year and a half sober, so I was around 20, 21 years of age, I was literally disabled. I couldn't work. I had difficulty dressing myself without help. I couldn't clean my own apartment. I had to drop out of school because my neck and back hurt so bad that I couldn't do my homework or read. Like I just couldn't function because I was in so much pain. And I started going to doctors and chiropractors and massage therapy. I started trying to do all the things, and nothing was bringing me relief. And I was becoming suicidal once again. So in my addiction, I was suicidal in those years. And I was desperate. And at some point, I had some friends that said, like, hey, you've never gone to a yoga class. You've never tried yoga. Why don't you try yoga? And this was in the early 90s. So yoga wasn't quite as popular in this country as it is now. And somehow I managed, this is like absolutely miraculous if you understand that the field of yoga therapy is also a relatively new career. I walked into a yoga therapist's class in 1993. She was one of the first people, I think, in the United States to have studied yoga therapy, and she was a longtime yoga practitioner. And I'll cut to the chase here. What the experience that I had was, for probably the first time in my life, during Shavasana, which is the deep relaxation part at the end of a class, I experienced a feeling of peace and calm. And I'm cautious about using the word joy, but I actually felt joyful in my body. I had cried throughout the entire class. As soon as I started to get into the sensations in my body and move my body, there was a tremendous amount of emotional release. And I didn't really understand what was happening one bit, but I knew that by the end of that class, for the first time in years, there wasn't pain in my body. And I actually felt good. And I was like, what is this mystical experience that just happened? And thankfully, I spoke to that instructor, and she and I began one-on-one work together in yoga therapy. And since then, I've been on a journey to heal naturally. The doctors that I saw, a lot of them suggested drugs as a means to healing my body. And because I was early in recovery, I was a hard no on any painkillers, antidepressants, all the things that were suggested to me, because I had been diagnosed repeatedly with fibromyalgia, which is a real fun diagnosis to get because they're like, we don't know what causes it or anything. So here's some pills if you'd like. And the pills option wasn't for me at that time. I don't think there's anything wrong with taking pills. For some people, that's perfect path. But for me at that time, it was a hard no. So I've been on this path of discovery, and my body has been a map. It's been a guide for me. And there have been so many different practitioners and modalities and things that I've done over the years to the effect that now I live really joyfully in my body. And there's still some chronic pain that I experience, but it's always very manageable. I've got tools now to handle that and to live a really full, joyful life despite that.
I love it. And also, it helped you so much that you decided to make this your profession, your career, that now this is what you do all the time. So how did you decide to become the thing that was helping you?
So somewhere along the line, I was a professional swing dancer. So in my previous career, I was jumping around to American jazz music. And I was teaching dance all over the world and performing, and my body really, really hurt. And I was really checking in with myself. I had experienced a couple injuries, and one of the things that I really like to do when life presents me with something difficult is I really try to look at all angles of why is this here for me? And one of the things that I realized through one of my injuries that forced me to stop dancing was that I was actually really unhappy with what I was doing with my career, that this career actually wasn't something that my purpose at that point in my life. And so when I really sat with, okay, what is something that I feel very passionately about? It was the concept of helping other people. And because I had learned so much about healing holistically at that point in my life, it was just a natural next step of I would really love to be able to help people the way that my first teacher helped me. And when I looked at what I may have to offer, I felt like the one thing that I had to offer that was perhaps really valuable was an understanding of what it was like to live with chronic pain and to heal from addiction and to heal from past traumatic experiences. And so I felt really passionately about sharing that with others. And so I registered for my very first yoga teacher training. And I didn't know at that time that I was going to do all the other stuff that I do. But I just thought, well, this feels like the next right step. Why don't I go get my yoga teacher certification and see what happens next? And after that, it was like, oh, maybe I actually want to be a yoga therapist. And after that, it was like, and this modality really piqued my interest. And that thankfully continues to this day. One of the things that I'm most excited about is learning and just continuing to learn more to help myself and to help others.
I love what you said about the next right step. Like, we don't always have to have it figured out. It's like following your impulse of what feels right now. And then the path kind of appears step by step. But that's really a courageous thing to do.
Yeah, and that is exactly how it works for me, right? It's you take that one step and then the next one appears, and it's pretty miraculous to have that. But what it also takes is kind of like this faith. Like I have an affirmation, a couple of them. I have a lot of affirmations that I say to myself every day, but I think of those affirmations kind of as reprogramming my subconscious belief systems and choosing what I'd like to feel within to create in my life. And one of them is my life is a continuous stream of miracles. The other one is everything is always working out for me. Because my conditioning is the opposite of both of those things, right? That initial programming is very much the opposite of that. And when I focus on that truth of like, everything's always working out for me, and my life is a continuous stream of miracles, there's this wonder that occurs to me where I become very attuned to looking for little kind of hits within my gut of like, yeah, that's the right thing next. Just go do that. And it's something that I listen for inside of myself. And I trust that. And it's led me to some pretty amazing places and some interesting places and some incredibleness. So, yeah.
Okay, well, I want to ask you about yoga therapy, but before I do that, I want to back it up because I know that there's people listening like, yoga, I can't do yoga, I'm not flexible. So, for some people, there's that block with yoga, and I'd be curious to know if you could explain a little bit about what is yoga through your lens, and then how is that helpful? Why would you suggest that to somebody going through addiction or anxiety, depression, any of the things? Like, why is that helpful for a body?
Right. That's a great question. I have a lot of opinions about yoga and just that word in and of itself. I think for most people, when they hear the word yoga, they picture maybe somebody with their legs behind their head or in some sort of contortionist experience, or they picture our American version of like a sweaty power yoga class. And what yoga means in reality is the integration of all aspects of what it is to be human. And I look at that, the lens that I was taught to look at that is this 5-layered aspect of our humanity, which is we have a dense physical body, but we also have an energetic body and an emotional body. And that energetic and emotional body, I think, are analogous to the nervous system. Then there's this idea that we have a causal body, which another way of saying that is a body that is the result of our subconscious belief systems. So our deep conditioning, our patterning that we grew up with, that actually manifests in our body as well. And then the last body is this idea that inherent in all of us is this bliss body, this ability to feel blissful within our body. And I liken that to a nervous system model that talks about how it is just the most human thing to feel compassion and connection and safety in our bodies, right? So this idea of yoga integrating all of those aspects of a person. And yoga is much more than poses, right? So yoga is a lot more than the movements that we think of as a yoga class. That's what is called poses or asana in the Sanskrit, which we don't have to get into Sanskrit. But yoga is a lot more than that's just one aspect of the classical definition of yoga. There's 7 other aspects that define it, which include things like breath work, which include things like meditation, focused concentration, right livelihood, the way that I'm choosing to show up and the things that I do in the world and the things that I choose not to do in the world. This idea of introspection. So it kind of encompasses psycho-emotional pieces of what we are, physical pieces of what we are, and really through all of those practices can lead one to actually feeling really centered within themselves. So when I think of yoga, I think of all of those things. And for myself, we'll just speak to my own experience of when I showed up to a yoga class, my physical body was in complete disarray. My nervous system was in complete disarray. I was dealing with anxiety and depression, so stages of really activated nervous system and an experience of shutdown. So my nervous system was a bit of a wreck. I showed up with all of these a baggage of belief systems from my conditioning that were playing out in my life. And I was not very in touch with an experience of peace or joy or connection within myself or with other people. And by the end of class 1, when I was having that mystical experience of what just happened to me, it was probably the first time in my life that my nervous system was in a little bit of a state of regulation. And so all those other things kind of started to come into alignment as well. And that yoga class, it was a class that involved gentle movement. It involved being encouraged to notice what was going on in my body. It involved me for the first time ever being sitting with kind of discomfort within myself and being okay with that, like not having to respond to it and get away from it. It was just like, oh, okay, I feel you, hamstring. What is that I feel? And kind of getting into an inquiry with sensation. Yoga is vast. It's very, very vast.
Yeah, I would just wanted the listeners to hear that you don't have to be super flexible or, I don't know. They talk about a yoga body. I'm like, are you doing yoga? Do you have a body? Then you have a yoga body.
Yes.
Yeah. Because I know that some people have had maybe not the best experience with a yoga class, and then they're like, never again. And it's been such a helpful modality for so many that I would like to encourage people to kind of gently come back if maybe they've not had such a great experience. And then you talk about yoga therapy. So how is that different from yoga? How is that different from therapy? Or maybe it's the same.
The field of yoga therapy, just like yoga, is vast. The now in 2023, is that what year it is? Now there are a lot of different schools that offer yoga therapy certification. And just so our listeners can kind of get an understanding, there are levels of yoga certification. And being a yoga therapist is the most educated level. It's the most training that a yoga instructor or yoga therapist will have been through. And there are different programs that have different focuses. So there are some schools that focus mostly on the dense physical body, right? So you have a pain here, my prescription is do these things, perhaps similar to what a physical therapist might do. You come in with an issue and then you use asana or poses to fix that thing. And that's very valuable. And that is one aspect of the work that I do. However, I don't use a lot of classical yoga poses at this point in my education. I use other modalities that involve gentle movements to allow the body to unwind. So there are some modes of yoga therapy that focus more on the emotional body. And we might use the discomfort that's in the body as a guide to what are some deeper emotions that are underneath that. And so there's some brands of yoga therapy that focus solely on that. The type of yoga therapy that I studied worked with all of it, or works with all of it. So when I see an individual client, we're going to look at those 5 layers that I was talking about. What's going on in your physical body? What's going on in your emotional body? What's going on with your energy body? How's your nervous system? What's your subconscious belief systems looking like? And what practices can we do that are going to get you more in alignment with that experience of the bliss body? So sessions with yoga therapy, depending on where your yoga therapist went to school, might look a little different. I tend to think of the brand of yoga therapy that I offer as very holistic, meaning we're going to look at all of those layers of what's happening within. And we're going to use the tools of yoga that I mentioned earlier. What kind of breath work, what kind of movements, what kind of meditation. We're going to use some of those tools to help with all of those areas for an individual to come into a more integrated and happier, peaceful version of themselves.
Yeah. I'm curious about, you said as you started moving your body, emotions were coming up and you were crying through that whole yoga session. Why is that? I've seen that happen before and I've experienced that too, where, when doing yoga asana and going through a class, that all of a sudden this really strong emotion will come up seemingly out of nowhere. Could you say what that's about? Do you know what that's about?
So it's very common when individuals practice yoga or actually any movement modality. So it can happen during dancing, it can happen just in an exercise class for release to happen. And I think the simplest way to put this is our past experiences can live as tension or contraction in the body, muscular tension. So the human stress response is something that's common to all humans. And I think sometimes we forget that we're mammals, but we are. Other mammals do this too. But we have perhaps tension that can be stored in our bodies. You could think of it sometimes perhaps as the energy it takes to repress emotion, because sometimes it's not safe to express our emotions. So you can think about that for a second. Like, remember the last time you had tears well up? What did it feel like to hold those tears back? That takes an incredible amount of muscular tension in the body to repress or withhold those emotions. And so when we are in a yoga class, we can release, or the nervous system resets the tone of those muscles that had been holding all that tension. And when that happens, the body wants to discharge the energy or let go of the emotion that was held in that place. A really succinct way of saying it that you sometimes hear is our issues are in our tissues, right? So when and that happens to me quite a bit when I practice. So I can be, and it is not always crying. Sometimes it's laughter, right? Sometimes it's other emotions can arise, but it's a pretty common experience. And in the classes that I used to teach, a lot of public classes, and I would talk about that in the beginning of class of like, hey, whatever arises or shows up for you during class is normal. It's just a part of being human and it's all welcome here. So give yourself permission to just let it come up and out, because it just wants to come out of the body. So that's a little bit of what's happening. It's pretty normal. It's 100% normal for every body.
Would you say that depression, anxiety, PTSD, all of these things, that they can impact somebody's chronic pain? Like, is there a direct correlation with that?
Yes, there is. I'll speak just from my personal experience that what I found was that there was an incredible amount of inflammation happening in my body. And part of the human stress response, if we stay in that heightened state of stress for a prolonged period of time, there's a tremendous amount of inflammation in the body that develops. There is also a heightened blood sugar level. So our liver is just pumping out glucose. And so there's inflammation that's happening in the body. And that shows up as joint pain. It can show up as muscular tension and pain in areas of the body. So, yes, there is a very direct correlation between those two things.
So it would be common if somebody was having any of these experiences of depression or anxiety or PTSD to feel pain, like that could be a direct result of what's going on in their emotional bodies showing up for their physical body.
Absolutely.
Okay, and then I'm curious about how your body work weaves into what you're doing with the yoga therapy and how you use that as well.
Yeah, so touch is profoundly healing. I got involved in wanting to offer massage therapy because it was a really powerful piece of my own healing process. And what I started to notice when I was working with my clients was that touch was profoundly healing. And so the way that I weave those in is typically people will do either a combination session with me where we do a period of time that is movement based, and perhaps there's some talking that happens. So you asked about, talk therapy, and is yoga therapy similar to that? There can be a processing component where we are kind of sharing about what that person is noticing in their body and just holding space for what's present to be present and acknowledged. And sometimes there's meaning that arrives for people and deep understandings that can come about through that type of work. Then when we get on the massage table, there is an opportunity for the person to feel nurtured, to feel really seen, and to experience a level of deep relaxation. And sometimes there's processing that happens there too. When there are people on the massage table, sometimes a tremendous amount of awareness can come about when we're just being present with and placing hands on areas of the body that are talking to us. And I have a trauma informed lens that I use with both my yoga therapy sessions as well as my body work. So it's always done in a way that feels very safe to the individual. Sometimes people get on my table. So similar to our expectations about yoga, sometimes people have expectations about body work too, that it's going to have to be really intense and they're going to be in pain on the table. And that's not the way that I work. I can do deep work, but it's always to a level that allows the person to still stay in the relaxation response and to really notice what's happening in their body rather than, sweating and not being able to breathe on the table. So it's a form of body work that feels very loving.
I was going to say, having been the extremely fortunate recipient of some of your healing touch, the word that comes to me is collaborative. It feels very collaborative working with you. And sometimes you get on somebody's massage table and you feel like a piece of meat, like they're just doing something to you and not being very aware that there's a human being underneath their hands. And you are the opposite of that. And I love how the emotion is not only okay, but it's welcomed. I think sometimes we get on the table and we might have a release of emotion, but then we're embarrassed because we don't want the massage therapist to think they're hurting us, or, it's just a lot of emotion. So I think that's something unique about you too, that you really can hold the space for whatever emerges without, overreacting, but just letting it flow and encouraging it gently. So I think that really makes your treatments unique. I just have to talk you up because you're so gifted. Yes. And I'm curious, what are some things when you're working with somebody and they do have chronic pain and they are in the thick of it, going through the struggle of life as we do? What are some things that you recommend to them? Just small lifestyle changes, maybe that even our listeners could start implementing now to reduce inflammation or just to get their bodies feeling a little bit better.
Yeah, I think it's so important. I really like to meet people where they are, right? So I think that change happens really incrementally. And I find that change is most effective when it's something that actually feels manageable, and when it feels like something that we can do rather than this giant mountain of like, well, now you're going to never eat sugar ever again. Start today. It's like, well, maybe we could just try going for a couple 15-minute walks every day and see how that feels. Like things that we don't have resistance to, subtle things. So because I often work with movement, if I am working with somebody that's coming with a specific pain syndrome, let's say I have lower back pain and somebody is in front of me that is experiencing that, I might prescribe for them a few movements that help to release the areas of the body that are chronically contracted, that are the cause of that pain. And it's generally something really simple. We will sometimes record it on their phones so that they have something that they can just pop on really easily. And 10, 15 minutes, a couple times a day, do this and see how you feel. Like that's a really just easy place to start if you're working one-on-one. If you're just a person watching this now, as I said, take a couple 15-minute walks every day, right? Just movement is key. I say that because being a person that was literally and has been at other times in my life crippled by chronic pain, like a pain that's so intense that I couldn't walk, I've had to find ways to move my body to heal. And so getting into an 86-degree swimming pool, because that was the only place that I could move my body, that's where I went. So if we can find ways to simply move, I I I always have to remember that I'm a mammal. My body was designed to interact with the environment. It was designed to walk and reach and bend down and squat. Like my body was designed to move. And we get to figure out how to reclaim movement when our body feels stuck and incapable of that. So I think that that is one of the most important pieces. And that's one of the things that I help people with a lot. Let's figure out how your body can move. And let's begin to gently invite the body to unwind into more and more expressed movement. So it can be a really small thing. Get in a swimming pool, go for a walk, even like get in a hot tub and just kind of like stretch. I mean, don't hurt yourself, but like just figure out ways to gently move the body. A huge component for me was figuring out what I was eating that was causing more inflammation in my body. And so I didn't do that gradually because I was in such a state that I was so willing to do whatever the person that I was working with told me to do. So I cut out sugar and everything that digests high glycemic overnight. And what happened overnight in about 5 days was depression, anxiety, and pain diminished from, let's say, a 9 in a 1 out of 10 scale down to a 3. My brain cleared. And it was so profound to me that I was like, oh my goodness. So much of why I was in so much pain had to do with what I was putting in my body. So I gently encourage people to just look at, okay, what are you eating if you're a person with chronic pain that's high glycemic, and how can you reduce that? And start drinking some water too. Hydration was really, really key. I think the simplest thing that is helpful is breathing. Pause for 2 minutes or a minute and a half and just take 3 really deep breaths where you focus on a long, slow exhale. Get breath in the body, and it doesn't have to be anything fancy. It can be as simple as inhale through your nose, blow the exhale out of your lips. And if that feels okay, try doing that 2 more times, right? Something as little as that can actually do a lot to reset the system. The last simple thing that I suggest is go outside, get in touch with the earth, get some sunshine on your skin, go to your favorite place to sit and look at the ocean, or go and look at some trees, get together with friends and laugh, be with humans that you feel connected to. And if there aren't too many humans, cuddle with your dog or cat, right? So these little things can actually make such a huge difference.
I love all those little things, and I love to think about it like stacking the deck in your favor. Like maybe cuddling with your dog will not cure your depression, but all these little things you do that you start chipping away at it, and then all of a sudden you reach a critical mass with these healthy little habits and you start feeling better. So I love that. Getting outside, connecting with other people, moving your body any way you can, looking for those high glycemic foods that cause inflammation, and then of course hydration, which I am I am guilty as charged of not hydrating.
We all struggle, right? We all
Yeah.
struggle.
Yes. Yes. I'm curious for you personally, what are your three non-negotiables? Like what are your pillars of health?
So definitely hydration and my food. Like we'll just put that in a category that is a commitment. It is a non-negotiable. And moving my body. So whatever that looks like. Some days it's just making sure I go for a walk at the beach. Some days it's I go to the gym and I definitely do my workout. Some days it's I get on the floor and I roll around and I do some yoga or other movement practices just for like 5 to 10 minutes. So always something that gets me embodied. Maybe sometimes it's just turning on a song and dancing for 5 minutes or 2 minutes or something like that, right? So it's just something that connects me with my body. And so the last one is just making sure that I breathe. And it doesn't have to be like a fancy pranayama practice. That's the Sanskrit word for breath work or energy control. It doesn't have to be something fancy pants. It's just, did I take some intentional breaths today? How am I breathing? And just to make sure that I am taking some nice long slow exhaling breaths, some nice deep inhales, just getting the breath process. One of the things that I really like to educate people to is that breath creates movement in the body. All these muscles in the neck and upper back and the rib cage and abdomen and pelvic floor, all of those muscles are involved in the breath process. So trying to create a really full breath to reset some of the tension in some of those muscles, just that can be highly restorative to anyone experiencing chronic pain.
Yeah, I love that.
Mhm.
So even if movement is really a challenge, you could start with the breath and start moving those little muscles and start unlocking some of your pain. So that seems really accessible for everyone to be able to do.
100%. Yeah.
Alison, you are so delightful. You are such a healer. I'm glad that you're my friend, and I'm glad to know that you're out there to help others. Where can people find you if they're curious about working with you or just connecting with you?
Thank you, Michelle. I'm so glad you're my friend too. I love you. Um, where people can find me. So my website is my first and last name.com, AlisonScola.com. There's one L in Allison and an I, Alison. So AlisonScola.com, you can read more about me there, and that has all of my contact information on my website. You can also find me on Instagram at Alison Scola, as well as Facebook at Alison Scola.
Wonderful. And I understand you have a an offer for our listeners. I guess they'd have to be local, but if you could share with the listeners what you are offering.
Yeah. And they don't necessarily have to be local. I do yoga therapy sessions online all the time.
Ooh
So
la
if
la.
they're, yeah, so if they're not local, we can hang out online. But the offer that I have for everyone is 3 sessions for $300, which is a $60 discount. I would be so delighted. These are for new clients if you're interested, and you can mix and match modalities. So you could do a session of yoga therapy and 2 sessions of massage. We could mix it together in one session for the three. Whatever you'd like to do, we can do in those 3 sessions.
Oh, you guys take advantage of this. This is such a great offer, and your body will thank you for it, and your mind. Just such a great experience to be with you, Alison. Thank you so much for sharing yourself with our listeners, and have a great day.
Thank you, Michelle. You too. It's been such a joy to be here with you all, and I look forward to connecting again soon.
Take care.
Thanks so much for listening. This has been Sophia Unfiltered, a podcast by Sophia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Reese. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.